Hey everyone, welcome back to the weekly wrap with HealthCap. Let's kick things off with some big news from CMS. This one's for all the nurses out there.
That's right. CMS has rolled out a new initiative aimed at tackling the ongoing staffing crisis in nursing homes. Under this program, registered nurses can receive up to $40,000 in financial incentives to work in long-term care.
And that's not just a lump sum. They're spreading it out over 3 years to help nurses with student loan repayment. Plus, there's a $10,000 stipend for living expenses during that time.
It's a major push to bring more skilled nurses into senior living communities, which have been struggling with workforce shortages for years. And let's be real, staffing challenges impact care quality, so this program could be a game changer.
Absolutely. But here's the catch. There's always a catch. The program has eligibility requirements, and it's not available to every RN. CMS is prioritizing facilities in high-need areas, so it's worth checking if your community qualifies.
If you're an RN or you know one, this could be a great opportunity. More details on the program are available from McKnight's, so be sure to check it out.
All right, up next. What's happening with Paxlovid and the government's patient assistance program?
The U.S. government's patient assistance program for Paxlovid will remain in place for 2025, ensuring that residents who need it can still access the treatment.
Yeah, and that's important because Paxlovid is still one of the most effective treatments for COVID-19, especially for older adults and those with underlying conditions. The big news here is that Medicare beneficiaries will continue to have access through a rebate program or by enrolling directly in the assistance program.
And starting in March, if a Medicare patient doesn't have prescription coverage or just can't afford it, they may still qualify for free Paxlovid through the program.
That's great, but I'm guessing it's not quite that simple, right?
Right. Patients covered under Medicaid, TRICARE, or the VA Community Care Network should check with their plans first because coverage varies. But if they face high copays, they might also be eligible for the assistance program.
So the bottom line is, if someone needs Paxlovid but cost is a barrier, there's still a way to get it covered. But they may have to jump through some hoops.
Exactly. And since COVID-19 isn't going anywhere, making sure residents have access to treatment is still a priority. You can check out all the details from AHCA and Cal.
All right, let's shift gears. The FDA has issued a warning about a certain kind of epinephrine nasal solution that healthcare professionals need to avoid. Let's dive into it.
The FDA is sounding the alarm on certain epinephrine nasal solutions, and healthcare professionals need to pay attention to this one.
Yeah, they're specifically warning against nasal solutions made by BPI Labs and Endo USA. These aren't FDA approved, but they've been showing up in clinical settings, and that's a big problem.
Right, because they're being mistaken for injectable epinephrine, which is used in emergencies for severe allergic reactions. The issue: nasal solutions don't have to be sterile like injectables do, and if they're mistakenly injected, it could lead to serious infections.
That's terrifying. And the packaging doesn't help. The FDA says it closely resembles approved injectable epinephrine products, which increases the risk of dangerous mix-ups.
Exactly. That's why the FDA is urging healthcare providers to stop using these nasal solutions immediately. If there's any in stock, they need to be pulled before a mix-up happens.
This is a reminder that even small packaging similarities can have big consequences in a fast-paced medical environment. If you're working in a senior living community, double-check what's on your shelves and make sure residents are getting the right medication.
If you want to read the full FDA advisory, you can find the details directly from the agency.
Next up, we're talking about face masks. You've heard the debates, but what does the latest science actually say?
Okay, new research is shedding light on an ongoing debate. Do face masks really help reduce infection risk? Turns out the science says yes, but with some key details to consider.
Right. A new report breaks down how the effectiveness of masking depends on factors like fit, filtration level, and even how consistently people wear them. It's not just about putting on any mask, it's about using the right one in the right way. And one of the big takeaways? Higher quality masks like N95s and similar respirators provide significantly better protection than cloth or surgical masks, especially in high-risk environments like senior living communities.
Which makes sense. We've known for a while that not all masks are created equal, but This research reinforces just how important those differences are.
Exactly. And the study also highlights that even short-term masking, like wearing one when someone around you is sick, can meaningfully reduce transmission. It's not an all-or-nothing thing.
So while some people might be over the whole masking conversation, this research suggests there's still a place for it, especially in healthcare settings where residents are more vulnerable. If you want to check out the full breakdown of the study, you can find it on Medscape.
Coming up next, we're looking at how artificial intelligence is making its way into nursing homes. What's happening with AI in senior care? Let's talk about it.
So it turns out AI isn't just a buzzword. It's already being used in senior living communities to improve care and streamline operations.
Yeah, and while some people might hear AI in healthcare and picture robots taking over, what's actually happening is a lot more practical. AI is being used to improve things like resident monitoring, predictive analytics, and even staffing efficiency.
Right? And one of the big areas where AI is making an impact is fall prevention. Some communities are using AI-powered cameras and sensors to detect unusual movements and predict when a resident might be at risk of falling.
That's huge because falls are a major concern in senior living. If AI can help identify risks before an incident happens, that could mean fewer injuries and hospitalizations.
Wow, that is huge. AI is also helping with documentation and administrative tasks, reducing the burden on staff so they can focus more on direct care. For example, some systems can automatically transcribe notes and flag potential concerns in real time.
But of course, AI isn't perfect. There are concerns about data privacy, accuracy, and making sure technology doesn't replace the human touch that's so important in caregiving.
Right? So while AI isn't taking over nursing homes anytime soon, it's definitely becoming a tool that can help improve care and efficiency. If you're curious about the latest developments, McKnight's has a great breakdown on how AI is being used in long-term care.
And even if you aren't using AI in your community just yet, fall prevention is still a top priority. HealthCap has plenty of resources on falls available in our Resource and Education Center, so be sure to check them out.
And for our last story today, we're looking at a new study that explores how COVID-19 spread differently depending on the type of contact people had. How did factors like masking, ventilation, and social interactions shape transmission? Let's break it down.
Yeah, this one's really interesting. Researchers have been digging into how non-pharmaceutical interventions, things like masking, social distancing, and ventilation, actually impacted COVID-19 transmission. And their findings challenge some assumptions.
Right? Because early in the pandemic, most models treated transmission rates as if they were fairly uniform, like if you were exposed, you had a roughly similar chance of catching the virus. But this study suggests that's not the case at all. Transmission rates can vary by orders of magnitude from one contact to another.
Which makes sense, right? Not every interaction carries the same risk. A brief conversation outdoors is way different from spending hours in a poorly ventilated room with someone who's infectious.
Exactly. And what this study found is that when transmission is highly uneven like this, the effectiveness of interventions can be harder to predict. For example, broad mask mandates might have had less impact than we expected in some situations, while targeted measures like improving indoor air quality could have been much more effective.
So it's not just about whether an intervention works, but how it interacts with real-world transmission patterns. This could have huge implications for how we handle future outbreaks.
Absolutely. If we can fine-tune responses based on where the highest transmission risks actually happen, we could be more effective without resorting to broad restrictions that disrupt daily life.
If you want to check out the full study, it's published in the American Physical Society's Physical Review journals.
That wraps up this episode of the Weekly Wrap with HealthCap, and we covered a lot.
We sure did. CMS's new initiative to attract more nurses to senior living communities, updates on the government's Paxlovid assistance program,
An important FDA warning about unapproved epinephrine nasal solutions. We also explored the latest research on face masks.
Then we finished with how AI is being used in senior care and a fascinating study on COVID-19 transmission patterns.
If you want to read more about any of these stories, you can find the links on Angie's blog under the Weekly Roundup at healthcapusa.com/Angie's-blog.
Thanks for listening, and we'll be back next time with more updates on what's happening in senior living.